Inner Light Show. It's time to stop just surviving, and it's time to begin to thrive. It's time to live happier and healthier. Turn stress into strength. Noted author Debbie Mandel will show you how to move beyond personal doubts and fears and into positive perception to turn on your inner light. Here's your host, Debbie Mandel.
Greetings, everyone, and welcome to my show. Our guest expert is Dr. Norman J. Marcus, the Director of Muscle Pain Research in the Department of Anesthesiology, and is an Associate Professor of Anesthesiology and Psychiatry at New York University School of Medicine. He has been named one of the best doctors in New York and is the author of End Back Pain Forever. Here are some impressive and unusual ways to eliminate suffering from back pain, your core. Welcome, Norman. How are you?
I'm very happy to be here. Very well, thank you.
And how do you feel?
I feel great.
Okay, good. We want a doctor who practices what he preaches. All right.
Great.
We all know how we basically come into back pain, whether it's stress, raking leaves, shoveling snow, lifting. But how does it become chronic?
Well, although most people who get back pain, which actually is 80% of Americans will have back pain at some point in their life, but when you get an acute bout, means when it just comes on and it really hurts, in most situations people think that it gets better. So the statistics say that by 1 month, about 75% of people are better, and by 3 months, almost everybody gets better. But it's not really true that a large percentage of patients still have some sort of tightness or a lingering feeling that something isn't right and it's going to get worse again. And many of these patients don't go back to doctors, so that many people have given up on the medical profession because they're unhappy with the options that are provided. There are many patients are going to see chiropractors or directly to a physical therapist or to acupuncturists or to some other alternative medicine. And in the field in general, there's this notion that we really can't understand where back pain originates. So we have a label, a diagnosis called nonspecific low back pain or idiopathic low back pain. And it essentially refers to sprains and strains of soft tissue. Soft tissue is muscle, tendons, and ligaments. And that accounts for 70 to 80% of all the back pain that people have. When we look at the guidelines, though, for the treatment, for evaluation and treatment of back pain, from the American Pain Society and the American Academy of Physicians, that there is no mention of muscles at all. Most of the focus is on what we call the neuraxis, which is the spine, the discs, and the nerves that are coming out of the spine, even though that's not the number one cause.
That's what I found, by the way, fascinating about your book, is you're looking at the muscles, and I think muscle deficiency you wrote about, and muscle stiffness. And that to me was eye-opening because, you know, Dr. John Sarno, he dealt with the stress, and we could see how things stiffen in the back, and he would say that spines can look really bad on an MRI and people not have any pain, and other people who had a little bit of something have terrible pain. So is that where you're coming from?
Yes, but you see, you have to figure out what mediates the pain. So I don't disagree with John Sarno at all, and I do believe that a big part of people's back pain can be tension. And we all know that when we feel stressed and we have deadlines, that we can have discomfort in our shoulders and our low back. So the question is, how does stress do that? Well, it does it through muscles. Mm-hmm. That what happens is that the muscles tighten up when you feel anxious or when you feel pressed in your life. And that's part of what I'm suggesting in my book as well, that tension is one of the 4 reasons for muscle pain. There's tension, And then, as you mentioned, deficiency, which I define as weakness and or stiffness of muscles. Then there's spasm, when the muscle contracts and you can't move. And then the fourth is when the tissue is altered and needs some sort of procedure to make it normal again.
You know, many years ago, I would say I had a bout with sciatica. I would say too many squat thrusts in the gym, probably an overdoer's back. And I began a stretching program, 3 minutes here and there. And as I read in your book, where you show so many wonderful stretches, it really keeps it at bay, because my mother suffered from sciatica for 30 years. And in those days, Norman, they told you to lie in bed, which was the worst thing possible.
That's right. And when I started my training, that every bed in the hospital had what's called a trapeze strung over the top of the bed, so you could pull yourself up, and half the beds in the hospital were occupied with patients who had back pain. And the instruction was to be at absolute bed rest for at least 2 weeks, where you weren't even allowed to go to the bathroom. And we realized that that was very bad advice. And it was based on an ill-conceived notion of why we have pain in our backs. And as you know, that's not prescribed any longer, and the whole idea is to get up and move and be as active as possible, as soon as possible, when you get back pain.
I think that when John Sarno wrote his book, he looked at back pain as a specific kind of stress, anger, if I remember correctly, and he would have people talk to their backs and say, I know what you're trying to do to me, and I'm going to let it go even if I don't remember. Do you believe in that?
No. I mean, it's tension and stress are not just suppressed anger. There's suppressed fear, there's suppressed sadness. If you think about any feeling that you're carrying within you that's not easily expressed, that's going to have a muscle counterpart. So, I mean, if you're sad, you can think of yourself with your head drooping and your body looking without any energy, or if you're full of anger, you could feel like your shoulders are raised and your fists are constricted. So your body expresses the feeling, whether or not you're conscious of the feeling and whether or not you're able to talk about the feeling. And in my book, I talk about the importance of getting in touch with what you feel when you have somebody who's struggling with any kind of pain problem. And
well, let's hold that thought. It's very important. It's important for our cardiovascular system as well. We will return with Dr. Norman J. Marcus, author of End Back Pain Forever.
Now you can take Debbie Mandel home with you. Her book, Turn On Your Inner Light, Fitness for Body, Mind, and Soul, will help you decompress with healthy, positive, concrete solutions. Common life challenges are presented so that you can quickly find the help you need. Emotional tips, original meditations, and a fun and easy-to-follow fitness workout for each mindset. This revolutionary new method will help you rewire mind and body to take back your power. Get it on Amazon.
Are you overwhelmed with the burden of taking care of children, parents, or both? Are you taking care of everyone else except yourself? It's time to change your habits and re-energize. Debbie Mandel gives you an innovative and easy-to-follow program for good health and happiness. In her magical new book, Changing Habits, The Caregiver's Total Workout, Debbie Mandel shows you step-by-step how to find the optimal balance between giving and receiving, and guides you to exercise and eat right to take care of yourself. What are you waiting for? Read Changing Habits and start training for your life. Life does not need to be a burden. Get Changing Habits, The Caregiver's Total Workout on Amazon.
You're listening to the Turn On Your Inner Life show. I'm your host, Debbie Mandel, and I'm speaking with Dr. Norman J. Marcus, author of End Back Pain Forever. Before commercial break, Norman, we were talking about self-suppression and how that sabotages your back, self-sabotage. Do you want to continue with that?
Right. So if you're struggling with trying to manage your pain or eliminate your pain, and we know that tension is a major factor, that it'll really be difficult for you to relax if you're sitting on feelings that you don't want to experience or you feel uncomfortable sharing with another person. So all I was saying was that it's not just anger, but that a physician may suggest a technique to deal with your anger, and that's fine. But I don't like the idea of saying every pain is related to this specific feeling. It just doesn't make sense to me. Just as every pain can't be related to tension. Mm-hmm. It doesn't make any sense.
It's probably the weakest link that we have in the body, maybe, in terms of the stressor.
It's a universal issue that all human beings struggle with being able to experience and to express painful feelings. So nobody's unique in that way. Some people are more adept at being able to communicate their feelings. I think women typically can communicate feelings easier than men, that they're given license to do that, and license to cry, and license to show physical expression of emotion, and men tend to be more repressed. But everybody struggles with these issues, and it is part of the whole process of getting better. Now, it may not be your major problem with your back pain, but if it is, I give you some suggestions in the book as to how to catalog your feelings and get in touch with feelings that you may not be aware of, and then how to manage them better.
Also, I think what you made a point in the book about is some of our work habits. I know that I feel stiffer. I'm a writer, so I can write for hours and get lost. I don't do that anymore. I make sure to get up and move around so I don't compress my spine. Does that make sense to you?
It certainly does. So prolonged positioning isn't good. The body wasn't made to sit in one spot and move in a very small range. Let's say as a writer, you're moving in a very tiny range with your arm and your shoulder and your hand. So what you want to do, let's say every 30, 40, 50 minutes, is to put down the pen and just do some movements of your arm and shoulder and stand up and sort of shake it out, and then you can go back to doing it again. Even if it's a brief respite from that activity, it can be enough to prevent doing damage. When I say damage, it can be just a small thing in your muscle that can then end up to years of discomfort.
Yes.
So
I love the case histories you had in the book, and you had, how the young man who overworked himself for hours, and then, comes, and the journey of people. Some have had surgery. Is surgery ever a solution? Really?
Yes, sometimes it is. I mean, if you have a herniated disc and it's pressing on a nerve, and the nerve is very important. Let's say it's a nerve that goes to your bladder, and it controls your urinary sphincter, and it also controls muscles in your leg, that you may end up with weakness in your leg and inability to contain urine, and that can be quite serious. And in a situation like that, surgery may be indicated very quickly.
How do I, as a layperson, know? I guess that would be an emergency situation, right? If you're having trouble or with your rectal, function. Right. But how do I make sense of it? I'm going to tell you that I personally know people who have had 2 or 3 back surgeries that didn't work. It wasn't right. I've done some reading, and they don't even recommend back surgery for the most part. That's why I think your book, End Back Pain Forever, is right on the mark. How do I know?
Well, there's, we call them red flags. If you don't have the red flags, then you're probably not a good candidate for surgery. So that includes pain that doesn't vary. It's just there constantly. It's totally there from the moment you wake up to the moment you go to sleep. It interferes with your sleep. It's accompanied by pain that radiates down your leg. It's also accompanied by weakness in your leg, loss of sensation, and that when the doctor checks you, that your reflexes are diminished or absent. So when they tap on your knee or tap on your ankle, you don't get that reflexive movement. In addition to that, if you're actually having problems containing urine, then you are somebody who has what's called the cauda equina syndrome, and in a situation like that, you certainly need to consider the possibility of surgery. If you have a fever, if there's swelling, redness, or heat in the region that you have pain, these are all signs that say you may have a serious underlying condition that has to be addressed quickly so that you can eliminate whatever is going on that is ultimately a source of your pain. However, for the most part, as I said before, most people's diagnosis is nonspecific low back pain, meaning that there's a sprain or a strain of muscle, tendon, or ligament, and that if treated in a rational way, it's just going to go away. And rationally means putting ice on the area that hurts and gently moving and trying to stay active in a reasonable way that most of the time you're going to get better. But what you want to find out is, why are you somebody who's getting your back pain? And it may be that you're too sedentary. It may be that you don't do any exercise. It may be that as you got older, you didn't change your diet, because you can't eat the same when you're 16 as when you're 60.
Oh, but I do. But we'll come back to that and return with Dr. Norman J. Marcus and End Back Pain Forever.
Dear listeners, I'm excited to tell you about my new book, Addicted to Stress. This is a message you need to hear. Are you addicted to stress? Do you do it all while everyone depends on you? Where's all this pressure coming from? It is coming from inside you. This is why my publisher, John Wiley, asked me to write Addicted to Stress, a woman's 7-step program to reclaim joy and spontaneity in life. This fun-to-read book teaches proven strategies to reclaim your life, silence your inner critic, build a healthy body, and reframe your thoughts to change your life for the better. Dare to be happy without the guilt. Addicted to Stress is easy to get. It's available at Barnes & Noble and other fine bookstores everywhere. You can also buy it at Amazon and other online retailers.
We're back with Dr. Norman J. Marcus, author of End Back Pain Forever. So really, what I got from the book is to mind my muscle. And now let's say I come to you, you had these interesting treatments with injections. Could you tell us about it?
If you have pain that lasts for longer than 3 months, it's quite likely that your muscles are altered, that they're tight, that they don't ever totally relax in the area that you have pain. And you may feel like knots or little nodules in that muscle. And what's going on is that there's a little bit of spasm in parts of that muscle. And where that spasm occurs, meaning that the muscle is constantly a little bit contracted, it squeezes its own blood supply. And when you squeeze the blood vessels in that muscle tissue, you don't get enough oxygen because the blood carries the oxygen. And in addition, when you don't get enough oxygen, the acidity of the muscle changes. It means that the pH goes down, which is a measure of alkalinity or acidity. And when you have diminished oxygen and too much acidity, that the vessels start to leak a little bit. And they get a little bit of fluid that comes out, and along with it some chemicals, which are irritating chemicals. And you can have these knots in your muscle that last for years. And one way to treat them, if the pain's been there for a while, is to needle the area, to break up the tissue, and allow it to reform in a normal fashion. And the way we do that is that we pay attention to where the muscle attaches to the tendon, and the tendon attaches to the bone. This is called the entheses, the muscle attachments. And that's where most of the pain fibers in the muscle are. Many people may have experienced what they call trigger point injections in the muscle tissue itself, but it's frequently not a lasting relief that they obtain, because the area that needs to be needled is where the muscle attaches to the tendon and bone. And that's what we do. And so the way we do it is that we pre-medicate a person so that there's no pain whatsoever during the procedure. It's like you don't know that anything even happened. And following the procedure, there's 3 days of a physical therapy protocol. And most people get better. Mm-hmm. So, on our website, we have videos from Good Morning America, Today's Show, Fox and Friends, of multiple patients who've had pain for years, in some cases, who are all better after only a few injections.
Yeah, the case histories were truly remarkable, and it made sense. For me, when the truth resonates, it just does, and I like the stretches that you had depicted in the book. They're very clearly delineated, and that's a new lifestyle. A couple of stretches, a few minutes a day, it's not a big deal. Now, if we want to learn more about your work and see the videos, I assume you have a website.
Yes, I do. So it's www.nmpi.com, which stands for Norman Marcus Pain Institute, nmpi.com.
That's really impressive. Let me ask you also, do you believe in supplements?
Well, it depends. Anything that can help can harm. So you do something that, like for example, there was a big interest in vitamin E a few years ago, and people were taking larger and larger doses.
Yeah.
And we realized that too much was a bad thing.
And they're not regulated, really. Shouldn't we be getting, like, most of our phytonutrients from just unprocessed foods?
I agree with that. However, sometimes it's hard to get enough of what you want to get.
That's true.
So, like vitamin D, 1,000 international units a day is not a bad idea. A small dose of vitamin E, like 400 international units, as an antioxidant is not a bad idea. CoQ10 as an antioxidant is not a bad idea.
Well, our time has flown, but we can get it in the summer in the Northeast. We can just expose a little skin.
That's true, too.
Well, thank you so much for helping us end back pain forever, and I'm a believer of your work.
Thank you very much, Debbie.
Affirmation of the week. Don't believe everything you think. And now for the latest medical trends. Loneliness. The unpleasant feeling of emptiness or desolation can creep in and cause suffering to people at any age. But it can be very debilitating to older adults and may predict serious health problems and even death, according to a new study by the University of California researchers. Exposure to common antibacterial chemicals and preservatives found in soap, toothpaste, mouthwash, and other personal care products may make children more prone to a wide range of food and environmental allergy, according to research from Johns Hopkins. A new survey indicates that parents believe TV and other screen media hold educational value, but are they using it for that purpose? Many busy parents use it as a babysitter. the American Academy of Pediatrics recommends that there should be no screen media viewing at all for children under age 2, and that for older children, parents should engage in viewing and interacting with their children about the program material. A brain pacemaker called deep brain stimulation, DBS, remains an effective treatment for Parkinson's disease for at least 3 years, according to Loyola University. Researchers at the University of Michigan revealed that digoxin, the active ingredient in foxglove, can enhance the body's own protective mechanism against high blood pressure and heart failure. A novel form of vitamin B3 found in milk in small quantities provides remarkable health benefits, now before you get excited, in mice when high dosages are administered. And this concerns treating fat into brown fat, and it increases muscle performance, improves energy expenditure, prevents diabetes development, and all without any side effects. So research on B3, which is found in milk, might be very helpful for people suffering from obesity and likely to get diabetes and maybe fatty liver disease. And according to Harvard Women's Health Watch, cutting fat and exercising for weight loss beat any of the fad diets. Keep it simple. Well, we come to the close of another show. I have an educational website totally free, turnonyourinnerlife.com, where all the radio shows with the guest experts are archived for your listening pleasure at your leisure. My site, turnonyourinnerlife.com, takes you right into YouTube. Subscribe to my free newsletter at turnonyourinnerlife.com. You'll get a heads up on the latest radio shows, which will be emailed directly